and we're going to get started this morning. Welcome to the Family Home Child Care WAC presentation. The session is being recorded and will be made available to you at a later date. We will send that information out in listserv when it is available. Also, due to the nature of this presentation, there will not be a question and answer period. However, if after the presentation you do have questions, please feel free to submit these questions in writing or email them to us. The email address will be posted at the end of this presentation. The intent of this presentation is to highlight the major changes or additions to the family home regulations. We are now calling them licensing standards. These standards are a result of research, many years of meetings with licensees, DAL staff, and other interested parties, comments received by DAL, and DAL management decisions. These standards are final and will be in effect beginning March 31st, 2012. This slide articulates the overarching reason why there are WAC requirements for licensed child care providers or licensees. I will give you a moment to read this slide. Based on feedback, the chapter layout is changed. It was decided to no longer use the question and answer format. The chapter is factual, with the licensee as the main player. The chapter is not written as a one-for-one with the current WAC. As a result, the numbering system is completely different. The regulations are called standards. They are no longer considered minimum licensing requirements. The intent is that the standards are the foundation of the licensed child care business. The term provider is not used in this chapter. It has been replaced with the term licensee. The chapter is now organized to reflect the licensing process, starting with the intent and ending with enforcement if needed. Including an intent statement is something new. It reflects the overarching expectation of care for children in licensed child care in Washington. I will give you a moment to read the intent statement. In this chapter, definitions are included only for keywords that are used in multiple sections. If a word needing a definition is used in only one section, then the definition is included in that section. These are 4 key definition changes: accessible to children, licensed space, premises, unlicensed space. I will give you time to read these. An exception to serve special needs children will no longer be required. However, the licensee must have on file supporting documentation completed by a healthcare professional in the form of an individual education plan or an individual health plan or an individual family plan. It is the licensee's responsibility to make sure that everyone working with the children has an understanding of what the licensing standards are. The licensee must be aware of the local governmental agency's requirements regarding operating a home business. This includes, but not limited to, applying for a permit, if applicable, hours of operation, or fencing requirements. Also, the licensee must reside at the same location as the licensed facility, and the licensee must have only one license. The STAR's 20 hours of training must now be taken before a licensed applicant receives a license. This requirement was changed so that the licensed applicant will have important information about operating a child care business prior to becoming licensed. The individual taking the training must also register the training in merit. There is now a non-criminal background check process. The department is developing a non-criminal background check form that must be completed for each individual 13 to 16 years of age. The DSHS database for abuse and neglect will be used when reviewing an individual's qualifications. Criminal charges will only be considered if the individual has been charged as an adult. The license applicant must submit a copy of their Social Security card. If the license applicant does not have a Social Security card, they must submit a declaration stating they do not have one. DAL will develop a template for this declaration. A floor plan must be submitted and approved by DAL. The floor plan must include what is the license space and the space usage. This includes where the infants will sleep and where children will sleep in overnight care. The floor plan must also identify evacuation routes and emergency exits and identify the unlicensed space. Due to lead and arsenic hazards caused by the Tacoma smelter plume, a licensee living in King, Pierce, or Thurston County must contact the State Department of Ecology regarding soil sampling requirements. If the licensed home is served by a private septic system, the system must be maintained and inspected according to the local public health authority's requirements. The maintenance records must be kept on file. If the licensed home is served by a private well or water system, it must be tested according to the local health jurisdiction's requirements or tested every 3 years. It must be retested if problems occur. The test and repair records must be kept on file. During operating hours, the DAL licensor should be granted reasonable access to inspect the licensed space for compliance with licensing requirements. If any of the following are in unlicensed space, The licensee must submit a DAO form indicating the licensee is in compliance with the requirements. The space is the furnace area, guns and weapons storage, smoke detectors, and medication storage. To keep a non-expiring license, a licensee must submit the following every year: the annual licensing fee, background checks as required, and a declaration to continue as a child care. Please note, this declaration is a different form than the form mentioned in the previous slide regarding unlicensed space. The licensee must notify DAO before moving the child care to a new location. If the licensee does not do this, then the license is closed. The licensee must submit a request for authorization from DAO to hold other caregiving licenses or certifications. Examples of other caregiving license or certification would be respite care, foster care, or adult care. When applying for a license, the license applicant must submit a copy of a high school diploma or equivalent. Community colleges in the state of Washington have programs that work with individuals that do not have a high school diploma or equivalent. DAO will post information about this on the DAO website. A current licensee has until January 2017 to provide proof of compliance with this standard. The licensee and primary staff person must complete 10 hours of ongoing training. DAO may require specific training as a result of compliance concerns or training that may be required for all licensees. The licensee or primary staff person may take more than 10 hours of training. If this happens, then up to 5 hours may apply to the following year's requirements. This training must also be documented in merit. The licensee and each staff person must have current first aid and CPR. These trainings cannot be taken online. The primary staff person must take the basic 20 hours STARS training. This training must be taken prior to working unsupervised with the children. Assistants and volunteers must never be left unsupervised. Assistants and volunteers ages 14 to 16 must be within visual and auditory range of the licensee or primary staff person. This standard required records for household members is for household members that are not working with the children. Child attendance records and staff-to-child ratio records. When a person is signing a child in or out of care, a full signature is no longer required. Also, the licensee will have to keep documentation of what staff persons are counted in ratio when caring for the children. The licensee can choose a method to document this. An example would be on a calendar. You could use timesheets or staff sign-in sheets. The licensee can choose the method. Materials to be posted. Included in this item that must be posted is the licensee's philosophy of child development. Dal will post on the website ideas of questions to ask yourself to help you develop your own philosophy. Reporting standards have been broken into 6 sections. 3 key changes are reporting to 911. An example would be when a child is missing from care, 911 must be called immediately. Reporting to Washington Poison Center, this must be done after calling 911. And reporting to DSHS. DSHS must be called within 48 hours when there is suspected child abuse or neglect. There are now multiple standards regarding written policies. Two key things to note. The parent-guardian policies must include the program philosophy and the communication plan with parents and guardians. The program and staff policies could be combined by indicating staff responsibilities for each item listed. All policies must be submitted to Dal. Requesting a local fire department visit, a Dal form will be developed to be used to indicate the request was made for a visit by the local fire department. fireplace, wood stoves, and similar heating devices. If a fireplace, wood stove, or similar heating device is used, it must be inspected yearly. Documentation of the inspection must be kept on file. If the fireplace, wood stove, or similar heating device is not used at all, then the licensee must indicate this in writing. A telephone. A landline is no longer required. However, the licensee must have a working telephone available at all times. This telephone must have sufficient power to operate for at least 5 hours if there is an electrical power outage. Preparing for disasters. The licensee is expected to be prepared for various disasters. These requirements explain what must be done to be prepared. The licensee is also expected to train staff and volunteers and must document the training. Smoke and carbon monoxide detectors. There is now a new state building code requirement that must be implemented regarding carbon monoxide detectors. This applies to homes built after July 1st, 2010. That means a carbon monoxide detector must be in a home that was built after July 1st, 2010. Monthly fire inspections. It is expected that the licensee inspects the home monthly for possible hazards. Things to look for would be accumulated flammables, things too close to the furnace, or overloaded extension cords. A house plan, the licensee is expected to develop a house plan. By using the WAC for each of these topics, the licensee can develop the house plan. This is intended as a tool to better meet the needs of the children in care. Immunization. The Department of Health has new requirements when a parent or guardian requests an exemption to immunization. Carpets. Installed carpets must be deep cleaned at least yearly. This is not just vacuuming. This can be done by shampooing, steam cleaning, or dry carpet cleaning method. Cleaning, sanitizing, and disinfectant table. This standard includes a table that can be used as a quick reference to what must be sanitized and what must be disinfected. Lead, asbestos, arsenic, and other hazards. The licensee must take action when they become aware that the children in care have been exposed to any of the hazards listed in this standard. No smoking. This WAC is in line with RCW 70.160, Smoking in Public Places, formerly the Washington Clean Indoor Air Act. It requires no smoking when children are cared for in licensed family home child care. This includes no smoking anywhere in the home, in licensed space, and when transporting the children. First aid kit. The licensee must have a first aid kit in licensed space when on a field trip or in the vehicle when transporting the children. Syrup of Ipecac is no longer a requirement. Poisons, chemicals, and other substances. This standard includes a list of what is considered chemicals and other standards. They must be stored inaccessible to the children. We're going to take a 10-minute break to allow the interpreters that we have at the different sites a little time to breathe and to give you a couple of minutes. If you have any questions, we do have forms at the different sites, and like I said previously, we will be posting an address you can send questions to us. So I will be back in about 10 minutes. Okay, let's get started again. Removing recalled items. As a result of including this standard in this chapter, the provider recall safety statement that is currently required will no longer be needed. The indoor licensed space must have 35 square feet per child for the maximum number of children stated on the license. This is measured to include only the space intended for use by children in care. If an office or kitchen is not used by the children, it would still be considered licensed space. However, it is not counted when determining license capacity. Window coverings. As long as window coverings with pull cords or inner cords are installed correctly, they may be used. However, if a window covering with pull cords or inner cords is used on an emergency exit window, it cannot be anchored down to the frame. This will not allow the emergency exit window to be completely opened. Stairs. The slat opening of 3.5 inches wide is required for 3.5 inches wide is required for handrails and openings in any gates that are used. Electrical outlets, cords, and power strips. A ground fault circuit interrupter type outlet must be used near water, such as near sinks, tubs, or toilets. Extension cords must not be used long term. Lighting. When there are ceiling-mounted light fixtures, the light fixture must have a shatter-resistant cover or have shatter-resistant light bulbs or otherwise be made safe. The licensee must not allow bare light bulbs to be used. Lights or light fixtures intended for outdoor use must not be used indoors. Halogen lamps must not be used in any area accessible to the children. exit doors must have a way to alert the adult that the door has been opened. Also, an exit door not identified as an emergency exit door may be locked during operating hours. Night latches, deadbolts, or security chains may be used at night only if the licensee has approval from DOW to provide overnight care. Emergency exit pathways are considered licensed space. Each floor of the licensed space must have 2 emergency exits opening directly outside. One must be a door. The other may be a door or an emergency exit window. Every room used for licensed child care must also have 2 exits. This could be an emergency exit door and an emergency exit window opening directly to the outside, or an emergency exit door or window and an interior door or doorway leading to an emergency exit pathway, or 2 separate doors or doorways leading to 2 separate emergency exit pathways. If child care is provided in the basement or level of the home accessed by an interior stairway, the stairway must have a self-closing door at the top or bottom of the stairway. If the basement is used as licensed child care, there must be at least 2 emergency exits, which is either 2 emergency exit doors directly to the outside or 1 emergency exit door directly outside and another leading to an interior stairway that leads to an emergency exit pathway. Emergency exit doors must open directly to the outside and must remain unlocked during operating hours. It must also be able to be opened from the inside without a key, tool, or special knowledge, and unlocked automatically when the doorknob is turned. It must also be able to open to the full position. When an emergency exit door opens to a landing that is more than 4 feet above the ground, then it must have a landing with a stairway or ramp that leads to the ground level. Emergency exit windows must remain unlocked unless there is a manufacturer-installed latch that can be used. The window must also be able to open to a full position. Emergency exit windows on the ground floor may now be at least 5 square feet in area. All other emergency exit windows must be at least 5.7 square feet. The emergency exit window must be at least 20 inches wide. It must also be at least 24 inches tall. However, a window measuring 20 inches wide by 24 inches tall does not measure to 5 square feet or 5.7 square feet. Dell has developed a grid to provide a quick reference to what the window dimensions can be. This will be posted on the Dell website prior to March 31st. The emergency exit window must be less than 44 inches from the interior floor. If it is more than 44 inches from the floor, then a platform, such as a table or other device, must be placed under the window and remain there during operating hours. The emergency exit window is a window that children, the licensee, staff, and family members may use as an emergency escape to evacuate the home if there is a fire. When a fire occurs, the licensee's first responsibility is to evacuate the children from the home, not to wait for the fire department to arrive and rescue everyone. The National Fire Protection Association notes that in many home fires, there may be less than 5 minutes, and in some cases, less than 2 minutes after a smoke alarm sounds to safely evacuate everyone from a burning home. As a result of this information, there must be a place to land outside the emergency exit window that is less than 48 inches below the window. This can be the ground or a deck or platform that is built to meet the current building codes. Each room used for napping must have 2 exits. One must be an emergency exit door or window. The other may be an interior door that leads to an emergency exit pathway. Guns and other weapons. A gun cabinet can no longer be used. Guns must now be stored in a gun safe or locked room. If the gun is stored in a locked room, it must be unloaded and have a trigger lock or other disabling device. Storage of each child's belongings. This new standard requires storage be provided for each child's belongings. However, belongings for children from the same family may be stored together. Licensed outdoor space. If the licensee does not have 75 square feet of available outdoor space per child, then they may submit an alternative plan to DOW for approval. The enclosure for the outdoor space must be a fence that is at least 4 feet high. When the licensed outdoor space is not adjacent to the home, it is the licensee's responsibility to submit a written plan indicating how they will take the children safely from the home to the licensed outdoor space. When there are dangers adjacent to the licensed outdoor space, the licensee must submit a written plan indicating how the dangers will be made inaccessible to the children. Play equipment. The licensee must keep a copy of equipment specifications for all new equipment purchased after March 31st, 2011. Please note, this does not apply to used or handmade equipment. The Consumer Product Safety Commission's Outdoor Home Playground Safety Handbook states that grass is not considered adequate shock-absorbing material, especially under swings. As a result, grass is no longer acceptable as ground cover. This standard identifies the depths and types of acceptable ground covers. This standard reflects the Consumer Product Safety Commission's national standards for fall zones, especially in regards to how to measure from the front and back of swings. The new standard for fall zones for swings is measured to be equal to twice the height of the bar that holds the swing. Example, if the crossbar is 8 feet tall, then the fall zone would be 16 feet to the front and 16 feet to the back of the swing. Daily outdoor activities. The licensee is required to provide all children with at least 30 minutes of daily outdoor activities. This is unless any of the listed health and safety risks are present. Water safety. Anytime the children participate in water activities, supervision must be provided so there is one more adult above the required staff-to-child ratio. The licensee must make sure a certified lifeguard is present when the children are participating in water activities outside the licensed space. There are also new standards when infants and toddlers are participating in water activities outside licensed space. The definition for wading pools is a pool that holds 2 feet or less of water. If the children use a swimming pool on the premises, at least one adult present must have lifeguard training. Bodies of water. There are now 2 separate standards to address bodies of water. One addresses bodies of water or hazards on the licensed premises, and it holds more than 2 inches of water. If this is present, it must be made inaccessible with a physical barrier. The other standard addresses bodies of water outside or near licensed space. The licensee must submit a written safety plan to DOW indicating how it will be made inaccessible to the children. Birth through 12 years license. The maximum age has changed. It was that children could remain in care to the age of 12. The new standard allows the children to remain in care to the age of 13. This is in line with subsidy reimbursement requirements. Capacity and ratio. All children through 12 years of age count in capacity, including the licensee and staff members' children, visiting children, and children being transported. The licensee must include all children in care when determining capacity. The capacity and ratio table has been updated and a new definition added regarding walking independently. The new supervision standard includes requirements for general supervision of the children when the children are indoors or outdoors, and supervision of staff. It is important that the licensee is aware of what the children are doing at all times. In general, the licensee must provide supervision based on the age of the children in care, the layout of the indoor and outdoor licensed space, types of activities that are occurring, and any hazards that may be present. In the indoor space, the licensee or primary staff person must be able to see or hear the children and respond if needed. If more than one level of the home is licensed, the licensee or primary staff person must be on the same level of the home as the children. The children cannot be outside alone, no matter their age, unless the licensee or primary staff person can hear or see them. Watching out a window while the children are outside is not okay. When there are staff members present, the licensee or primary staff person must be aware of what they are doing and able to respond if needed to protect the children. Licensee absence. The licensee must include a staffing plan in the staff policies and procedures. This must be approved by DAL. This plan must include the licensee absences for outside employment if it occurs during operating hours, vacation if the child care is to remain open, or other regular absence that is reoccurring and is more than 4 hours in duration, such as attending class. All staff must be trained on licensing standards and documentation of the training must be kept. If a facility license compliance agreement is issued when the licensee is not present, then the licensee is responsible to retrain the staff and document the training. The added nurture and guidance interactions with the children, the added expectations in this standard is that the licensee and adults must interact positively with the children and adults. Also, the adult voices must not always dominate over that of the children. Prohibited interactions. This standard has added that the licensee must not use or allow others to use profanity, obscene language, put-downs, or cultural or racial slurs. Guidance and discipline. This standard has the added expectation that the guidance and discipline methods are appropriate to the child's developmental level, abilities, culture, and also related to the child's behavior. It clearly states that the licensee and primary staff person are the only adults that may discipline the children in care. Positive options for discipline. This standard has been added to provide the licensee with acceptable positive guidance methods. Separating the child from the group. When a child needs to regain control of him or herself, the licensee may separate the child from the group only if the child is over 3 years of age. If this does occur, the licensee or primary staff person must continue to supervise the child. Physical restraint. Only the licensee or primary staff person may use physical restraint on a child. If this occurs, the licensee is required to inform the parent or guardian and inform DAO. If physical restraint is used, the licensee may have to develop a safety plan with the licensor. Abuse and neglect. The licensee must train staff on prevention of child abuse and neglect and mandatory reporting requirements. We're going to take another 10-minute break to allow those of us who are talking nonstop to kind of rest ourselves. We will be back at 5 till 11 so we can continue with this presentation. Thank you. Okay, let's get started again. Program. Off-site activities. The licensee must have written permission to take the children on off-site activities. When the activity occurs less than once a month, the licensee must request a separate written permission. When the activities occur more than once a month, a blanket written permission may be used. An example of this is going to the neighborhood park on days that the weather allows it. Transportation. This standard is in line with RCW 46.61.687 regarding transporting children and the use of child restraints and car seats. This standard also has new expectations when transporting children, including taking attendance and never leaving the children alone in the vehicle, and maintaining staff-to-child ratio and capacity. The licensee may use public transportation to transport children. However, they must always supervise the children, including not sending the children on public transportation unsupervised. The licensee must limit the amount of time to less than 2 hours a day when children are in a vehicle. The intent of this standard is to address the amount of time younger children are in the vehicle as older children are transported to and from school. The licensee must be able to share the types of activities the children are engaged in. This can be done in a variety of ways, through displaying, through writing, or even using a checklist. The licensee must support each child's development and provide a variety of activities. These activities must include spatial concepts, which is an example of size and position, and numeracy, counting and numbers. All prepackaged art materials used by the children must be labeled as non-toxic and meet the ASTM D-4236 requirements. Screen time. This chapter has more detailed screen time standards due to the extensive discussion and research available at the time the standards were developed. Screen time use must not be violent or contain adult content. Children should not be forced to participate. Diversity. The licensee must provide an environment that reflects the children in care and diversity in society. The licensee must also be able to explain this to the licensor, either by demonstrating this or in writing. Prior to providing overnight care, the licensee must get approval from DAL. The daily schedule must also reflect whether evening or overnight care is provided. Infant care. Infant tummy time positioning. When infants are in care, the licensee must provide each infant with tummy time at least 3 times a day. Cribs. Due to new federal requirements, full-size cribs must meet the U.S. Consumer Product Safety Commission requirements by December 28, 2012. When full-size cribs are used, the licensee must have written documentation that the cribs meet the federal requirements. The federal requirement information will be added to the DAL website. Procedures to reduce the risk of sudden infant death syndrome. This standard now reflects added expectations regarding the use of blankets with a sleeping infant. Infant bottles. Glass bottles can be used. Glass bottles typically do not shatter if dropped. If plastic bottles are used, they must be labeled as safe and not containing BPA or phthalates. The licensee must also have a method to identify the bottle or cups for each child. There are now new standards when breast milk is provided for a child. This includes how the milk is stored and served to the children. Bottle feeding. When using a bottle to feed infants, the licensee must make sure the bottle contents are tested. This is to make sure that contents are not too hot. The infant must be fed on demand, or if the parent and guardian provided a feeding schedule, then the schedule must be followed. It is important that nothing be added to the bottle unless the health care provider has prescribed it. The licensee must have parent or guardian approval prior to giving infants solid food. Diapering and toileting. The diaper changing surface must not have any items on it that are not used for diapering the children. All soiled diapers sent home with the child must be kept in a separate container and not placed with the child's other belongings. The licensee must check each child's diaper at least every 2 hours. Hands must be washed before and after diapering. Prior to beginning toilet training of a child, the licensee must discuss with the parent or guardian the routine that will be used. The licensee must also use positive reinforcement and culturally sensitive methods. If modified toilet seats are used, they must be cleaned and disinfected daily or more often when soiled. Food service and nutrition. The licensee must provide meals and snacks to the children according to the USDA guidelines. A link to the USDA guidelines will be added to the DAO website. If a parent or guardian submits a written plan, alternate foods may be provided for a child. Children must be offered food at least every 2 hours, but no more than 3 hours unless a child is asleep. Children arriving from school must be offered a snack. When food is served, the licensee must not force the children to eat and must respect each child's cultural food practices. A food handler's permit must be obtained and maintained by the licensee and other staff when food is prepared and served. Washing dishes. The three-step method is no longer in the standards. It is now replaced by the hand washing method, which is immersion in hot soapy water, rinse, sanitize, and air dry. Food containers and utensils. If food is heated in the microwave, it must be in a container labeled safe for microwave use. Enforcement. Fines are now $150 per day for each violation. This standard includes non-continuation of a license as licensing action that may be taken. DAO may refer the licensee for technical assistance prior to issuing a probationary license. If the licensee refuses a facility license compliance agreement or a probationary license, this action may result in the non-continuation of a non-expiring full license. If an individual provides unlicensed care, they must submit a written agreement to the department indicating they plan to begin the licensing process. If this does not occur, DAO will post on the DAO website that the individual is providing unlicensed care. If an individual is providing unlicensed care, the fine amount is now $150 per day for each day unlicensed care is provided. So those are some of the major changes to the standards. What is Dow's commitment to you? Well, we will respond to all the questions you leave with us today or that you submit to the department on the website. We will do this using a frequently asked questions document and possibly developing future trainings. We also are committed to update and develop all required forms and also to develop other resources that will need to be available to implement these new standards. So what do we suggest you do to be prepared for March 31st, 2012, when these standards will be in effect? Become familiar with the standards. Become familiar by reading the standards. Check the Dow website for updated forms and other information. All that should be available after March 1st, 2012. You can send your questions to rules@del.wa.gov. We will review all the questions that we received today or that you sent to the rules mailbox, and they will help us to, like I said previously, develop a frequently asked questions document. And also to develop any future trainings or compile other resources that need to be available. As stated earlier, this session is being recorded and will be made available to you at a later date. Thank you for joining us. I will leave the website, the email address up for a little bit. Goodbye.
The organizer